The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Hello, everyone. My name is Dr. Charlene Ortiz, and today we are going to talk about counseling and clinical psychology. We're going to talk about the specific fields and what do they cover. We're also going to discuss what can you expect if you were to pursue a degree in these aspects, particularly if you're following a graduate degree, say, for example, if you're interested in a master's or a doctorate. One of the first things that I would like to mention is the history of psychology. Now, one of the first things that we will need to consider is who was the individual that was related and considered one of the first individuals who had a degree in psychology, particularly clinical psychology. And in this specific case, we're thinking about 1869. We are looking at Whitmer. And in this particular case, even though it is referred as clinical psychology, something that I would like to note is that today we would consider that particular specialty as school psychology. And why is that? Well, because one of the things that we need to consider is he conducted a vast array of testing with children. And generally, whenever we are conducting testing with children, we are focused, say, for example, in aspects of learning abilities, learning difficulties. Back in that time, we will refer to it as mental retardation, although that term is dated. Today, we use the term learning disability. Now, after that process was conducted, we started to notice that there was a need with adults. We started noticing that in this particular case, not only children needed help in regards to applications of psychology, we also started noticing that adults needed such care as well. Keep in mind that some of these settings also changed. So for instance, notice that hospitals and prisons were now being incorporated in some of the settings that we will utilize in practice. Now, another thing to consider is that after the First World War, we started considering aspects of assessment, right? Because we started noticing that we needed to conduct recruiting, we needed to start engaging in how we were going to engage with troops and provide aspects of recruiting, make sure that we were actually recruiting individuals who were indeed capable of being in service. Now, that led to another need. And when we're thinking about the Second World War, now the field of psychiatry was overwhelmed. And why is that? Well, because now we had a wide variety. We had a wide variety of individuals who would come back from the war. They would come back with some aspects that today we would define as post-traumatic stress disorder. And now the field of psychiatry was completely overwhelmed with how many troops were presenting some issues concerning trauma, PTSD, and war or conflict exposure. Because of that, the Veteran Affairs or the VA were encouraged into applying funding in regards to clinical psychology, and therefore we started applying that science in other areas. So for instance, in the military fields. Now let's go back to our slides. You heard me use the term therapy, right? You heard me use the term therapy. Now, when we are thinking about therapists, generally, we are referring to individuals who have a master's degree. A master's degree is that degree you would earn after your undergraduate degree. So for example, associates and bachelors, then you move on to the next echelon, right? You move towards the aspect of graduate school before you graduated undergrad, and that's why we refer to this term as graduate school. Now, another thing to consider is the aspect of clinical social work. Clinical social workers are also considered therapists because generally they do hold a graduate degree. Generally, this is in the fashion of a master's degree with a specialty in clinical work. And we're also going to cover a little bit more in detail what clinical work stands for and what does it look like. Now, in continuing with a master's level course, we notice that we can move up when it comes to our education. Now, there's other forms of therapists. So let's look into therapists who hold a doctorate degree. Now, the first one that I want to talk about is a psychiatrist, right? A psychiatrist. When we're thinking about a psychiatrist, this person is considered an individual who holds a medicine doctorate. Notice that their main focus is not therapy. Their first focus is the medical field. Because their first focus is indeed the medical field, what you're going to notice is that their intent is to prescribe medication. Their role is not to provide therapy necessarily. Their role is to provide medication. And we're also going to cover that a little bit more in detail later on. Now, generally, another field that we like to consider is that of a clinical doctorate. A clinical doctorate is that is a philosophy doctorate. Generally, psychologists do hold a doctorate in psychology, but a psychologist is an individual who holds a license to practice, particularly at the doctoral level. Now, there are other forms of doctorate that I would like you to consider, and that is a doctorate in counseling. A doctorate in counseling, notice that it is also a Ph.D. Notice that both are a clinical Ph.D. and a counseling Ph.D. They are philosophy doctorates, whereas a psychiatrist does not hold a philosophy doctorate. A psychiatrist will hold a medical degree. They hold a medical doctorate. And I cannot stress that enough. A lot of individuals, including individuals in the field, may confuse that. Individuals who are highly educated, sometimes they can use or interchange these terms, but in reality, they are very, very different practitioners. So in keeping with our slides, if we revert back to our presentation, we also have individuals in certain states that may be allowed to become licensed as a psychologist holding an EDD. And when we are talking about an EDD, notice that before, in terms of non-medical individuals, so for example, clinical PhD and counseling PhD, notice that their doctorate was in philosophy. But now this type of psychologist, albeit with some other requirements, for example, having a specialty in clinical work, if an individual holds a doctorate in education, that type of doctorate focus in clinical work may allow this individual to also become a therapist. So that is another doctorate degree that an individual may pursue in order to become a psychologist. I do need to remind you that the vast majority of individuals will hold a PhD. The vast majority of the states in the United States and unaffiliated territories, so for example, Guam, Puerto Rico, Virgin Islands, notice that the entirety of the US, generally, the requirement is a PhD. Now, generally for the EED, it might be a little bit complicated because the individual may have to get extra coursework or extra hours in order to practice in a specific state. Remember that it is your responsibility whenever you are deciding to pursue a degree to become immensely familiar with the laws of practice. Each state is going to have a board of examiners or board of psychology, board of psychologists, and these terms are used interchangeably most of the time. And this is the society, this is the governmental agency that is going to let you know which laws govern your degree. So it will let you know of which requirements you are needing to pursue. Now, if we continue back with our slides, we also have another form of doctorate. And this doctorate is a Psy.D. Now, when we are thinking about a Psy.D is immensely useful, right? It's immensely useful for an individual who is not interested in the research side of things, in the math side of things, in the statistical side of things that we generally use in order to conduct experiments, whether it be with animals or people. So notice that in this particular case, some individuals only want to practice and not do the experimental, quantitative, qualitative side of things. Therefore, a Psy.D may be a better fit for this type of individual. And why is that? Well, because it's good for persons who do not want to do that type of work. Generally, it has less requirements than, say, for example, a Ph.D. in clinical psychology, a Ph.D. in counseling, or a doctorate in education in psychology. So notice that in this specific case, generally, the individual will not have to write a thesis or a dissertation. For those of you who are not familiar with what a thesis is, something that I need to remind you is that a thesis is a type of paper. It's a type of project, or a dissertation. It's a type of project. Usually it's in a very extensive project. Usually it takes about anywhere between 1 and 3 years. Usually the average is 2. And what it is you're going to produce your own research from your own data, your own participants. So generally, this is a very long process in which you will become published. You will become a published researcher, albeit as a graduate student. Now, if you pursue a Psy.D, you don't have to necessarily write that project. There are many institutions that do not require an individual to write a thesis or dissertation for their doctorate or their Psy.D, because simply their focus is not the research side. Their focus is the application side, what I like to call roll up your sleeve and start working with clients, not so much the theoretical or research side of things, but rather the practice side of things. So let's go back to our slides. Now, for those of you who do not want to pursue a doctorate, right, we can also consider a master's degree. Remember, a master's degree is in between your bachelor's, your undergrad, and your doctorate. Now, you don't necessarily have to have a doctorate degree to be a therapist. However, most states do require that you have a doctorate in order to be a psychologist. Generally, most states, what you can expect is that for both a master's in counseling or in clinical psychology, generally, you can expect to be in school for about 2 years, plus or minus 3 years. And why is that? Well, because you may be required to write a thesis or a dissertation. You may also be required to do an internship. And for those of you who want more detailed information about what exactly is an internship, what does it look like in some of the requirements for a state, I'm going to link down below a detailed video that I did concerning that aspect. So let's go back to our slides. Now, when you are pursuing your master's degree, you're generally going to expect that you will have to become licensed at a master's level, right? Generally, you're going to have comprehensive exams, both in your preparation as a student and later on before you conduct practice. Now, notice that you are also going to be required to have supervised hours. And what do I mean by supervised hours? In this specific sense, when I am talking about supervised hours, it means that under someone who is licensed, you will practice yourself, meaning you will have your own client/patient base, depending on where you work. If you're working in a clinic or working outpatient, you will be under somebody's wing, someone who will supervise your work and your exposure with clients. Those hours and how many hours do you need is going to depend immensely on your state and your degree requirements. So for instance, for some states require that you do about 3,000 hours, and some states only require that you do, say, for instance, 800. So depending on the state, there's going to be some variation in regards to your internship. And the same goes for a doctorate degree. Now, a doctorate degree, of course, is more comprehensive, is longer. So therefore, your internship hours are going to be more extensive. If we revert back to our slides, notice that one of the last things that you will do when obtaining your master's, and once you do obtain your master's, is you're going to have a licensure exam. Now, a licensure exam can be, say, for example, those to become licensed as an associate counselor or a licensed practicing counselor. Now, these terms vary state by state, but in a very basic sense, as with a master's degree, you will be able to practice at a master's level after you become licensed. Now, remember, these requirements will change based on state, but generally that is what it looks like. Now, let's go back to our slides. When we are thinking about your master's degree, it does sound appealing, right? You don't have to write such an extensive paper. You may not even be required to write a thesis. So it does sound appealing. I do need to remind you that if you do earn a master's degree, notice that it's not going to be as competitive, right? It's not going to be as competitive at, say, a doctorate or a Ph.D. Right? It's not going to be as competitive when we are thinking about that job market. Now, there are some aspects that you could consider. So for example, a master's in social work, right? A master's in social work, what it implies is that it does have a better job market at the master's level, right? Because social workers, their role, they can also become therapists in some states, right? Because they will earn a degree in clinical social work. And once they earn a master's in social work, in clinical social work, they may be able to become licensed. Afterwards, they are more, let's say, sought after, because not only can they do therapy, but they can also do things such as outreach programs. They're always focused on that resource and element community aspect of therapy. Therefore, they are suited for other areas of practice. So that is one of the reasons why social work degrees are indeed competitive. So let's revert back to our slides. Now, when we are thinking about your degree, if you're trying to prepare for this master's degree, I need you to remember that one of the things that they will be looking for is that clinical experience. We're talking about getting your hands there and dirty, rolling up your sleeves, and actually sitting down in that chair with a client. So notice that they will be looking for that type of clinical experience. For those of you who are pursuing a degree in the service track, meaning that you're not so focused on the research side of things, but you are focused in the service practice side of things, notice that certain colleges will have certain courses to guide you towards that direction. So remember, make sure to look at your curriculum so that you are able to see whether or not your degree is more focused on the service application side of things, or is it focused more on the research experimental side of things. Now, let's go back to our slides. Now, we were mentioning a psychiatrist. We did speak a little bit about the different types of doctorates that people think of when thinking about mental health. Now, as I mentioned earlier, a psychiatrist is an individual who goes to medical school. It's an individual who goes to medical school. Now, I need to remind you that it is easier to get into medical school than it is to become and enter a PhD program in clinical psychology. It is much easier to get in that type of degree. It is easier to get into medical school than it is into getting in a clinical sense, right? And getting into a clinical doctoral program of a Ph.D. Generally, psychiatrists do have a residency, right? And what is that? A residency is basically a form of practice in which you are a resident or a fellow. Generally, this can look anywhere between a year and 4 years. And here you are practicing under supervision. You are in a setting in which you are practicing. And in this case, individuals who are earning a medical doctorate in psychiatry, notice that their residency, it's going to be about 4 years, give or take. The difference is because you are earning a degree in medicine, you are able to prescribe medication. You do have the ability to prescribe medication. And that medication is, of course, geared towards mental health, also known as psychotropics, medication that it's geared towards mental illnesses. I need to remind you, and I will stress this a whole lot, is that persons who have earned a medical degree in psychiatry do not major in psychology. These persons do not major in psychology. And that is very, very, very important. A lot of individuals become very confused. Say, for example, they think that a psychiatrist, his or her purpose is to provide therapy, but remember that their focus is not psychology. Their focus is a medical perspective. Both of them, both the psychological side of things and the medical side of things, have immense benefits when it comes to the treatment of an individual who is seeking help, who is seeking treatment for, say, for example, a mental illness or some adjustment concern, getting over certain things, and that's okay. One is not necessarily better than the other. Psychologists tend to treat, therapists tend to treat, I should say, through therapy, and a psychiatrist will treat through medication. They both have different purposes, and it doesn't make one better than the other. They simply have different objectives in their field. Therefore, a psychiatrist, I should say, is not specialized in psychology. That is not necessarily their main focus. So, because they are not necessarily geared and do not major in the side of psychology, these individuals, men and women or other individuals that practice psychiatry, notice that they may be a little bit slower into becoming used to or engaging in new forms of psychotherapy. Now, you did hear me say that their focus is to prescribe medication. Now, when we are thinking about psychoactive drugs or psychotropics, we can think about, say, for example, antipsychotics. We are thinking about medications such as in things that can be depressants, things that can be stimulants. And why do we use these terms, right? Why do we keep utilizing terms such as antipsychotics, depressants, stimulants, or things that cause hallucinations, for example, hallucinogens? That is because they have the ability to alter your affect. They have the ability to affect your behavior and your cognition. Every time you see the word cognition, I want you to think about the word thinking or thought, because generally that's just what we are referring to when we're using the term cognition. Generally, what tends to occur is that in this particular case, we are trying to cross that molecule, right? We're trying to move this molecule across the blood-brain barrier, right? We're trying to change the chemistry of that individual's brain because for whichever reason, so for example, some of the neurotransmitter or the chemicals that are in your brain that allow you to moderate your behavior, and experience certain emotions for whichever reason that the psychiatrist will determine, then they will notice that there is perhaps some sort of chemical imbalance. Now, remember that in my particular case, I am not a psychiatrist, so I do not prescribe medication. So let's revert back to our slides. I say that because even though my main focus is not the medical focus, it is immensely important that in your preparation with your degrees, you also think about medication and perhaps means to provide referral to individuals who may need that type of treatment. Now, when we're thinking about the blood-brain variable, I need you to remember that it's basically a barrier of tight cell junctions at the glial sense. So what I am referring to is whenever we are exposed to a medication, particularly a psychoactive drug, remember that this molecule is going to fight against that barrier. The point of that barrier is to protect you. The point of that barrier is to protect you from perhaps foreign substances that may be impacting you. So the point of crossing that barrier is that we can give you the medication that perhaps is necessary in order to alleviate symptoms. These could be, say, for example, symptoms of depression, say, for example, symptoms of anxiety, hallucinations, someone who is demonstrating aspects of being manic, or another way to refer to that is very elevated mood instead of very low mood. So notice that that is the intent of psychotropics. So let's revert back to our slides. Let's talk about one of the reasons that we are here, right? So a lot of you may be interested in a clinical doctorate, right? A clinical Ph.D. or philosophy doctorate. That is what I have. I have a doctorate in clinical psychology that I earned fairly recently within the last 2 years. So that is the doctorate that I possess. It's a doctorate in clinical psychology, and my specialty is in forensic psychology. But for right now, we're only going to talk about the clinical side of things. Now, what is a clinical PhD? What is a clinical doctorate? When we are thinking about a clinical doctorate, a lot of the focus of a PhD involves that of research, right? We have a lot of focus in research. We also have an immense focus on clinical training. If you recall from my previous slides, you'll remember that one of the things that I mentioned is that a Psy.D focuses on the application of things, right? It focuses on simply the application and not the research. With a PhD, however, whether it be in clinical or counseling, they are actually longer. They take more time to earn, because not only are you getting the Psy.D side of things when you're earning your PhD, because you will indeed engage in practice and learning how to do therapy with a PhD, but a PhD takes longer because you're also going to become a scholar. That is one of the main differences. You're going to start developing research. You're going to start contributing to the field through experiments, through qualitative research. So that's why a PhD takes longer, because you're getting the best of both worlds. You're getting the application side of things, rolling up your sleeves and working with clients or patients. And you're also getting the side of, let's say, working in a research environment. Now, research is not for everybody. A lot of people don't enjoy math, and a lot of the PhD coursework is indeed statistics. So because of that reason, some people tend to move away from the PhD side of things and start moving more towards the Psy.D side of things. So let's go back to our slides. Now, very important, a person who holds a doctorate degree in clinical psychology cannot prescribe medication. A person who holds a doctorate in clinical psychology cannot prescribe medication. Now, that is very different from the previous case that I mentioned, in which an MD, their focus as a psychiatrist, as a person who earned a doctorate in medicine, their intent is to prescribe medicine. Whereas a person who has a clinical PhD, such as myself, we are unable to prescribe medication. We are very, very not allowed to prescribe medication. I have to tell you that earning a doctorate in clinical psychology is immensely selective, right? It is immensely selective and is very competitive, both getting into school and then after school, right? So having that ability to earn a job is immensely beneficial, right? It puts you in a position where it is relatively easy to find a job, because it's a field that it's immensely needed, especially at a PhD doctoral level. So if we revert back to our slides, there are very strict requirements when it comes to a doctorate in psychology. So what does it take for me to be admitted in a clinical PhD program? If you recall from earlier, I mentioned that it is easier to get into medical school than it is getting into a PhD, a doctoral program in clinical psychology. And why is that? Well, because one of the requirements is that you should have a 4.0 GPA. Generally, the higher the GPA, of course, that makes you more competitive. But at a PhD level, remember that you are now becoming a scholar, so it is highly competitive. It is highly desirable that you have a 4.0 average. Now, another thing is that it is expected that you have a high GRE score. And what is the GRE? The GRE is an examination, right? It's an examination, it's a test. Imagine the SATs, right? When you were in high school, that allowed the institution to see how well prepared you were for college. So the GRE is the same thing, but instead of preparing you for college, seeing where you are for a graduate program, seeing where you are in the sense of PhD and doctoral school. So it is highly desirable that you do have a very high score. I do need to mention that some institutions are doing away with this requirement for graduate school. A lot of institutions are starting to not utilize the GRE as a requirement, right? As a requirement for admission. So I do need to mention that, because there may be a chance that whenever you apply for a graduate program in clinical psychology, there is a chance that you will not have to take the GRE, especially here in the United States. We are indeed moving away from that type of assessment. Something that it's immensely sought after whenever you apply for your clinical doctorate in order to be admitted is your application, right? Your application in the clinical side and your research, right? So one of the things they're going to look into, did you indeed have clinical experience as an undergrad? Did you have a practicum and internship as an undergrad? Did you conduct any laboratory studies, any research? Were you a research assistant? Did you do anything related to research? So a PhD program is indeed going to look into that. It's going to look into, did you roll up your sleeves and do practice under supervision? Of course, generally at an undergrad level, you actually wouldn't necessarily be actively providing therapy, more in the observation side of things. But they were also going to look into, did you indeed provide any research services? So were you a research assistant? Did you cooperate in a research? Was it published? Was it not published? So those are the kinds of things that a PhD application would look like. Now, immensely important. You heard me earlier say that a PhD is going to require a dissertation, or what we like to call a doctoral thesis. So I also want you to remember that sometimes we do use those as synonyms. Now, a dissertation, as I mentioned earlier, is an immensely extensive project in which you are going to create and develop contributions to the field, meaning that you are going to conduct research yourself. right? This is an individual effort. You are not going to be doing this in groups, because the intent is to show that you are indeed a scholar and that you are able to earn a PhD. You will generally have a team of professors and supervisors that are going to help you during that process. But again, this is an individual project in which you're going to contribute to the field of psychology as a science. You're also going to be required to have a clinical internship. Now, in a clinical internship, is going to look very different from one program to the other, in the sense that each program is going to have very specific requirements as to what your internship should look like, starting with how many hours do I need? Another difference could be how many hours do you need sitting at that chair, right? Sitting on the chair in front and having direct hours. It could also have indirect hours. So for instance, you're doing your own research, you're doing consultation, you're doing supervision, right? Because remember that a clinical internship, you're going to be supervised by someone who already has a license. This can also be the case after you graduate. So even after you get your doctorate, you might also need supervised hours, which is what I am doing right now. I am getting supervised hours, right? Because I have to practice under supervision. So notice that even after graduation, right? Because I earned my doctorate, even after graduation, sometimes you may be required to continue with supervised practice. So let's revert back to our slides. What can you do? What can you do to prepare for this doctoral degree? One of the things that you can do is looking into clinical experiences for the students that are viewing this, that are my students, or students from another field, or another professor, instructor, or things of that nature. One of the recommendations is to look for sites, right? And in this specific case, we are referring to the Crisis Services of North Alabama. Could be a good opportunity for undergrads. If you are not in our program, and if you're watching this because you've been referred to this link, remember that it is immensely important that you, as an undergrad, that you start looking for sites just as the one that I mentioned, in crisis services, anywhere where you can perhaps volunteer or work or have some sort of practicum and get that type of experience before you actually move into the doctoral side of things. So if you're watching this from another program, from another institution, remember, it is still immensely important to actually engage in that type of practice. So let's revert back to our slides. Another instance that will prepare you in order to earn a doctorate degree is having a strong academic foundation. For instance, in the institution where I work, our institution offers a sciences track, right? So not necessarily the applied services track, but we also have the sciences track. And what that means is that the focus that we have with students is the research side of things. These students are going to be immensely exposed to the statistics, to the research design side of things. So if you yourself are also in a sciences track in psychology, notice that your focus is going to be research based, whereas someone who is in the applied side of things, in the services side of things, their focus, they're still going to get statistics and research, of course, but their main focus is the application practice side of things. Now, if we revert back to our slides, something that is also sought after when it comes to the preparation of a clinical degree, it's important to see whether or not you can become part of a research. It is so encouraged that you become part of that specific aspect. We want to see whether or not you have co-authored a research, if you were able to present a poster of your own research, or are you published, right? We're looking for those strong researcher, scholar mentality. as an undergrad to see whether or not you are able to pursue a PhD, or what I like to refer to as a scholarly terminal degree. And one of the last things that you can do in order to prepare for a clinical doctorate is having a strong GRE. Remember, just like the SATs, you want to be prepared. You want to be prepared, and we want to see your ability to perhaps perform at a graduate level